हो गया कनेक्ट?
अभी अभी करो अब आया।
हाँ
ठीक है, ओके।
ठीक है, ओके 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 ओके। एक बार बाहर जाके सुनिए, मुझे बता दियो। Sakib, good evening, good evening. Just 5 minutes more and then we'll start the class. Yeah, Sakib, good evening. Ayush, good evening. Yash, good evening. Yes. Just waiting for other guys to join us up and then we'll start with the class. Yeah. Yeah. Pranchal, DJ, good evening. Good evening, guys. Good evening. Yeah. So I'll just open the presentation now so that the comments doesn't come on the screen. Yeah. Yes. तो चलो। Yeah. Yes, good evening everyone. I mean, I can hear you all out over here right now. I can watch your comments, everyone. Yeah. Lakshi, Rafi, Kamal, Sagar, Yash, Soumya, Pavan, Dinesh, Karanveer, Neo, Anshay, Ashwani, very good evening. Good evening, guys. Today we'll start with the lesson now. Yeah, we'll start. Hoor, Vivek, very good. Very good, guys. I hope you all are participating today as of now. So, yes. Yes, namaste, namaste. I mean, I am like happier than like you guys are simply starting. You are all joining today right now. Yeah, Rohit, कब आ रहे हो Almaty? So that's a very typical question. I don't have answer for that. We'll start in another 2 minutes, guys. Just let everyone join and then I'll start. Manjeet Singh, welcome, welcome. Yeah. ब्लॉग वाले भी आ गए हैं. Kapil, good. Yeah, I'll just start within another 2 minutes. Let everyone join. Yeah, let everyone join, guys, and yeah, we'll start. Okay. So we are all going to start with the osteology of the scapula bone, and I hope you guys remember that we'll be discussing all the relevant points regarding the scapula. Yes. Okay. So just waiting for all the students to join us up, because you all know that these classes are like very very essential as of now. And guys, please take out your pen, pencil, notebooks, Currently, I mean, I want every one of you to write the notes along with me, all the tricks, all the mnemonics, all the like points which I'm going to explain today. Yeah, Sunil, welcome. Good evening. Good evening. Yeah. So you all have to just write it. Okay. Meanwhile, guys, this is my WhatsApp number. You can all like connect to me on WhatsApp as well. Okay. So I've not mentioned it. So you can just connect to me on WhatsApp as well. Yes. Rasab, okay, Rasab is here. Okay, guys, I want every one of you to please just ask other students to join us up. I'll just start now. Okay, I just want Vidhi. Good. I just want everyone to join the class. Yeah. Vani, welcome, welcome to the class. Yeah, good evening, good evening. Late night studies are like very good. So we'll start with the class now. So what are the topics that I am going to cover in scapula? Firstly, we'll discuss the general points, the type of the bone, anatomical position of the scapula, the site determination, whether it is the how to differentiate between the right scapula, and along with that, how to differentiate it from the left scapula. So there are certain points of differences that I will mention in the presentation, and that will help you to distinguish between the right and the left scapula. Chaman, welcome. Paramjeet, welcome, welcome, guys. I mean, I am totally with you guys, and I actually want each one of you to join the class ASAP. Ask your friends to join and kindly master the osteology of scapula along with me. After that, I will discuss the parts of the scapula, the muscles, the ligaments. Arsh, welcome, welcome to the class, Arsh. Origin and insertion of muscles. Again, I will give you certain mnemonics, guys, to make it a piece of cake for you to learn all the muscles in just one single way. The functions of the scapula, articulation of the scapula, and ultimately I will end the session with the clinical anatomy of the scapula. So, okay, so let's just start with the general points. Yeah, Shakir, good evening. Shakir, good evening. I mean, I'm totally happy that you all are present and are all ready now with the yes. So now, guys, let us start with the scapula. You can see that I'm showing you the posterior view right now of the body. I am showing you the posterior view of the body. The posterior part you can everyone appreciate from this picture, and from this particular point it is very much clear that the scapula, it is the posterior bone of the shoulder girdle. So scapula, it is the posterior bone, it is the posterior bone of shoulder girdle, and remember that it is also called as the shoulder blade. It is also called as the shoulder blade. So scapula, it is also called as the shoulder blade. Okay, so you can very well appreciate that this green color structure that is marked over here, it is the scapula bone, which is located on the posterior aspect of our body. Okay, it is located on the posterior aspect of our body. That's why it is called as the posterior bone of the shoulder girdle, and ultimately it is the shoulder blade. Yes. Now, guys, okay, one more point that I wanted to mention, it is on the posterior side, but guys, can you like appreciate the midline of the body? Anything which is closer to the midline of the body, it is called as medial, and anything far away from the midline, it is called as the lateral. It is called as the lateral. So ultimately scapula, you can see the scapula, it is far away from the midline. That's why it is also called as the posterolateral. Okay, it is on like the more exact location, it would be the posterolateral. Okay, posterolateral. It is on the posterior side, and on the posterior side it is more towards the lateral aspect of the body. इट्स अवे फ्रॉम द मिड लाइन. जो बॉडी के मिड लाइन में है वो तो मीडियल होगा, और बॉडी के मिड लाइन से थोड़ा दूर दैट विल बी द लेटरल वन. दैट विल बी द लेटरल वन. यस. Yes, guys, I hope everyone is writing the notes along with me. Just give me a thumbs up that all are participating, and I truly want everyone to be here right now. I'm discussing very important bone right now. Obviously, guys, like if I'm taking class, just free sessions for you people, and I want active participation right now, guys, from every one of you. Yes, just give me a thumbs up, guys. Yeah, all are along with me. I want active participation, guys, and kindly ask your group mates, your friends to join the session ASAP. Pranjal, Soumya, DJ, Anshay. Very good. Kamal, Insha, Lakshi, very good. That day I have not discussed, but today yeah, Sagar, very good. Very good, guys. I'm totally happy with you guys, and I really want you. Yes, Yash, Ayush, Karanveer, New, Pavan. Okay, okay, guys, very good, very good. Okay, now, guys, coming on to the type of the bone it is. Okay, now remember, you know that we have two types of bones. Okay, these are the typical long bones, and we have the atypical long bones. Atypical long bones. Yes. Sakib, Garv, Hoor, Dev, Pavan, Bhupender, Hitesh, Neha. Very good, guys. I'm truly happy that you all are present and all are writing the notes along with me. Yes, I don't know why people just left. Hitesh, yeah, good. Now, guys, remember that typical long bones are the ones which are developed from the cartilaginous ossification, or they are developed from the enchondral ossification. Enchondral ossification. And remember, just to differentiate from typical and atypical long bones, it is the ossification through which they are developed. And that is why, guys, enchondral ossification is basically the ossification from cartilage. So scapula is basically a typical long bone. It is a typical, I will not say a long bone, but I will say a flat bone. It is a typical flat bone because it is developed from enchondral ossification. Okay, enchondral ossification, and more precisely, I can write that it is developed by cartilaginous ossification. Chondral का मतलब ही क्या होता है? Cartilaginous. Yeah, chondral का मतलब ही क्या होता है? Cartilaginous. So basically, it is developed from cartilaginous ossification. Cartilaginous ossification. It is developed from cartilaginous ossification. And that is why chondral का मतलब क्या होता है? Cartilage से. And which cartilage? It is the hyaline cartilage which is responsible for the formation of scapular bone. Atypical long bones क्या होते हैं? Which are not developed from cartilage, they are developed from membranes. Okay, so atypical long bones show membranous ossification, guys. Atypical long bones show membranous ossification. And remember that membranous ossification basically is shown by a long bone that is called as the clavicle. So clavicle is basically considered as an atypical long bone, whereas when we compare it with the typical long bones, we have multiple examples. Clavicle, not clavicle, it is the humerus, okay, radius, ulna, all the long bones including the scapula. So scapula is a type of typical long bone or typical flat bone, okay, which develops from enchondral ossification. Enchondral मतलब cartilage से बनता है, and which cartilage? It is the hyaline cartilage, guys. It is the hyaline cartilage. It is the hyaline cartilage, guys. So yes, let's okay. Now, guys, coming on to the anatomical position of the scapula, and I would like to mention some points. So the very first point that you all have discussed, that it lies on the posterolateral aspect of chest wall and covering back of the ribs, and that too from 2 to 7, that 2 from 2 to 7. करणवीर लेटेस्ट एडिशन जो है उसमें सिंपली लिखा हुआ है that it is developing from membranous ossification, and that's why I have mentioned the point it is a atypical long bone, and to categorize it as atypical, that's why I am mentioning it as like atypical, just because it shows ossification through membranes. Okay, so apart from that, coming on to the anatomical position again guys, so you can just see we have the first rib, ये rib second वाली हो गई, और second rib से start होता है. Okay, it starts from the second rib and it goes to the seventh rib. So second rib से लेके seventh rib तक it is attached on the rib. Okay, that is the and that too on the posterior side. ये posterior view देखने को मिल रहा है, it's the posterior view, and that too on the lateral side, क्योंकि बॉडी के मिडलाइन से दूर है तो ये पोस्टीरोलेटरल हो गया. ये क्या हो गया? पोस्टीरोलेटरल. ये क्या हो गया? पोस्टीरोलेटरल. And that was the first point. Okay, now guys, you can appreciate that we have a border that is called as the medial border, and that I am marking with the black ink. Medial border. क्यों medial border? बॉर्डर का मतलब तो आप लोगों को पता ही है. देखो, सरफेस में एरिया ज़्यादा होता है, बॉर्डर में एरिया कम होगा. ओके, दैट्स जैसे लाइक या दिस इज द बॉर्डर दैट आई हैव मार्क्ड ओवर हियर. और क्योंकि ये बॉर्डर मिडलाइन के बहुत पास है तो इस बॉर्डर का नाम क्या हो जाएगा? मीडियल बॉर्डर. इस बॉर्डर का नाम क्या हो जाएगा? मीडियल बॉर्डर. ठीक है, सो मीडियल बॉर्डर जो है बेसिकली इट इज लाइन ओके पैरेलल टू द वर्टिब्रल कॉलम. ये वर्टिब्रा है ना हमारे, तो अल्टीमेटली अभी हम जब बॉर्डर्स और सर्फेसेस देखेंगे तब आपको और अच्छे से क्लियर होगा. बट अभी के लिए इतना जान लो, जो मीडियल बॉर्डर है स्कैपुला का, ये स्कैपुला है, स्कैपुला का मीडियल बॉर्डर क्यों? क्योंकि वो मिडलाइन के पास आ रहा है. ठीक है, तो अल्टीमेटली वो बॉर्डर बेसिकली विच इज कमिंग वेरी क्लोज टू द वर्टिब्रल कॉलम. ओके, सो विल मेंशन दिस पॉइंट ऑल्सो. सो द मीडियल बॉर्डर lies parallel to the vertebral column, and remember it is 5 centimeter away from the spine. It is 5 centimeter away from the spine, and it is 5 centimeter away from the spine. So that was another, yeah, it is parallel to the vertebral column, and you can very well appreciate that medial border, it is basically 5 centimeter away from the spine. Yes, apart from that guys, remember you can see a process over here. Okay, just let me use some other ink and that would be like more easier. Yeah, you can see a process that I have marked with red, and that is called as the coracoid process of the scapula. Okay, that is called as the coracoid process of the scapula. And remember, in anatomical position, the third point, the coracoid process, we will just discuss the parts, don't worry. The coracoid process projects forwards. It projects forwards. Okay, and slightly laterally, because this is the midline of the body and it is on the lateral aspect away from the midline, slightly laterally below the junction between the lateral 1/3 and medial 2/3 of the clavicle. देखो अब ये क्लैविकल है, सपोज ये क्लैविकल है, तो मीडियल 2/3 और लेटरल 1/3 के बीच का जो जंक्शन है, इस जंक्शन में से जस्ट इसके नीचे देयर विल बी अ प्रोजेक्शन ऑफ द कोराकॉइड प्रोसेस ऑफ द स्कैपुला। देखो प्रोसेस का मतलब क्या होता है, सपोज एक बॉडी है, बॉडी के हैंड्स हो गए, तो हैंड्स आर लाइक द फ्री मूविंग पार्ट्स ना, तो इसी तरीके से स्कैपुला भी एक बोन है और उसी बोन के कुछ प्रोजेक्शंस होते हैं, दैट इज कॉल्ड एज द प्रोसेस, एंड दैट्स व्हाई कोराकॉइड प्रोसेस है दैट इज एक्चुअली coming just at the junction slightly below between the lateral 1/3 and the medial 2/3. So yes, I just wanted a thumbs up from every one of you that the anatomical position is clear to everyone, and yeah, all are participating in the lecture, guys. I will be asking questions in between, so I want a proper attention, guys, from every one of you. Yeah, one proper attention, so just let me know everyone has written this. Yes, Pranjal, very good. Arsh, I am truly happy that you guys are participating. And remember, like you will be benefiting a lot in future. लाइव क्लासेस का जो मज़ा है वो वीडियो लेक्चर सुनने में नहीं आता. इट्स द वे यू पार्टिसिपेट, यू पुट क्वेश्चंस, इंट्रैक्शन इज कंप्लीटली देयर. अभी पवन, वेरी गुड गाइस. आई मीन आई डोंट नो व्हाई मैक्सिमम स्टूडेंट्स आर नॉट कमिंग. पहले तो क्लास 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 करते और जब क्लास होती है तब दे डोंट कम, एंड दैट्स व्हाई दिस द सिंपल रीजन आई डोंट प्रेफर to take classes because no one like cares. Anyways, coming on to the site determination, guys. Yeah, Shrestha, Neha, very good guys. चल साइट डिटर्मिनेशन स्टार्ट करते हैं. साइट डिटर्मिनेशन, आयुष, चंदन, वेरी गुड. आई डोंट नो फ्रॉम वेयर यू ऑल आर पार्टिसिपेटिंग, बट आई एम ट्रूली हैप्पी दैट यू ऑल आर देयर. Okay, site determination, the very first thing, the structure that is marked in red, बच्चे इसको हम लोग स्पाइन बोलते हैं. इसको हम लोग स्पाइन बोलते हैं, या फिर हम लोग इसको स्पाइनस प्रोसेस बोलते हैं, या फिर हम लोग इसको स्पाइनस प्रोसेस बोलते हैं. एंड रिमेंबर वन थिंग, दैट दिस स्पाइनस प्रोसेस इज लोकेटेड पोस्टीरियरली. लोकेटेड पोस्टीरियरली, yeah, it is located posteriorly, and that was the first point that you have to differentiate. जब भी स्कैपुला आपके पास दिया होगा, अगर ये स्पाइनस प्रोसेस आपको देखने को मिल रहा है तो वो साइड पीछे की तरफ की होगी, एंड दैट इज द फर्स्ट पॉइंट ऑफ साइट डिटर्मिनेशन. Coming on to the next point, that is this structure which is marked in red, that is the second one, and remember it is called as the glenoid cavity. It is called as the glenoid cavity. अलमाटी कब आ रहे हो? अरे बस अलमाटी बुलाओगे. You guys are horrible यार. मतलब ओके चलो अभी फिलहाल देखते हैं. So remember that the glenoid cavity is basically located laterally. It is located laterally. Glenoid cavity, it is basically located laterally. तो अब मुझे आप लोगों से आंसर जानना है कि ये कौन सा व्यू है, ये एंटीरियर व्यू है कि पोस्टीरियर व्यू है. ये जो आप स्कैपुला देख रहे हो, विच व्यू यू आर एक्चुअली विजुअलाइजिंग दिस पर्टिकुलर स्कैपुला? Waiting for your answers, guys. I'm honestly waiting for your answers. I just want to know how well you are participating as of now. So yes. Yeah, I'm waiting for your answers. हितेश, गर्व, कमल, प्रांजल, अंश बच्चे गलत हो गया. अभी मैंने आपको बताया था कि पोस्टीरियर व्यू में तो ये स्पाइनस प्रोसेस दिखता है ना. पोस्टीरियर व्यू में तो स्पाइनस प्रोसेस दिखता है ना अंश. तो ये पोस्टीरियर व्यू तो नहीं हो सकता, इसमें तो मुझे स्पाइनस प्रोसेस कहीं दिख ही नहीं रहा. तो अल्टीमेटली इसका ऑपोजिट होगा, दैट इज द एंटीरियर व्यू, एंड दैट इज लाइक आई वांटेड टू टेस्ट यू हाउ वेल यू आर एक्चुअली लिसनिंग, बट इट्स ओके, या वो गलती से कभी कभी हो जाता है. सो आई होप नाउ इट्स क्लियर कि पोस्टीरियर व्यू में तो सर स्पाइनस प्रोसेस दिखेगा, और जो व्यू मैं अब दिखा रहा हूँ इसमें तो स्पाइनस प्रोसेस है ही नहीं. So ultimately my point of saying is कि spinous process is always located posteriorly, and that is, yeah, it's okay. मतलब गलतियां करते हो, that is the thing that I want from you people कि आप participate करो, that's what required. कोई बात नहीं, यहाँ कर रहे हो एग्जाम में नहीं होगा, that's what I want. Okay, so glenoid cavity is located laterally. तो अब मुझे बता दो ये वाला बॉर्डर कौन सा होगा, द वन मार्क्ड विद बी, और ये वाला बॉर्डर कौन सा होगा. चलो बी और सी का आंसर दे दो फटाफट. आई एम वेटिंग फॉर योर आंसर्स गाइस. लाइक इट्स म्यूचुअल डिस्कशन. लाइव क्लास का तभी मतलब है, अदरवाइज मैं रिकॉर्ड करके भी डाल सकता था यूट्यूब पे. सो आई जस्ट वांटेड टू नो कि ये बी और सी व्हाट विच बॉर्डर्स आर दीस. नाउ थोड़ा सा मतलब आई जस्ट वांटेड टू टेस्ट यू कि आप लोग कितना ध्यान से सुन रहे हो. या B or C. B is lateral, C is medial. Okay, Sakib. Again wrong. B is lateral, Pranchal. Okay. चलो, अभी काफ़ी लोगों ने ना बहुत गलत आंसर्स दिए. सो आई विल जस्ट ट्राई टू हाईलाइट नाउ सर्टेन थिंग्स गाइस. अगर मैं बोल रहा हूँ कि ग्लिनॉइड कैविटी जो है वो लिटरली लोकेटेड होती है और इसी के साथ ह्यूमरस कनेक्ट होता है, तो ह्यूमरस ग्लिनॉइड कैविटी के साथ कनेक्ट हो रहा है. सो अल्टीमेटली ये वाला बॉर्डर तो यार लेटरल हो गया ना, ये वाला बॉर्डर तो लेटरल हो गया, क्योंकि ग्लिनॉइड कैविटी अगर लेटरल साइड पे है तो बॉडी के मिड लाइन के पास तो नहीं आएगी, तो ये लेटरल बॉर्डर होगा. तो ऑटोमेटिकली ये वाला बॉर्डर जो क्या हो जाएगा, बी वाला, दैट विल बी द मीडियल बॉर्डर. दैट विल बी द मीडियल बॉर्डर गाइस. दैट विल बी द मीडियल बॉर्डर. दैट्स व्हाई आई वांटेड टू टेस्ट यू हाउ वेल यू आर लिसनिंग गाइस. इट इज द बी इज द मीडियल बॉर्डर एंड सी इज द लेटरल. ओके, ग्लिनॉइड कैविटी अगर लेटरल साइड पे, ग्लिनॉइड कैविटी ऑटोमेटिकली हेड ऑफ द ह्यूमरस के साथ आर्टिकुलेट करती है, तो तुम्हें तो पता ही है कि ये तो वैसे भी लेटरल साइड पे लोकेटेड है, तो इसके साथ वाला बॉर्डर तो अल्टीमेटली लेटरल ही होगा. या करणवीर. सो दैट वाज द पॉइंट आई वांटेड टू टेस्ट यू गाइस. यस, आई होप नाउ इट्स क्लियर टू एवरीवन. I hope now it's clear to everyone. Yeah, Akash says yes. I hope everyone is clear now. Yeah, so now guys I will start with the parts of the scapula, and now I will discuss each and everything in detail. Till now we were just visualizing the things. Now I really want everyone to join the class. Don't leave the class and just pay attention to what we are discussing right away. Yeah. Okay, very good guys. So now starting with the parts of the scapula guys. Parts of the scapula. Parts of the scapula. अब ध्यान से सुनना. सबसे पहले हम लोग इसको दो पार्ट्स में डिवाइड करते हैं. मेजर दो पार्ट्स क्या होते हैं, एक होती है बॉडी और एक होती है प्रोसेस, और इसके तीन प्रोसेस होते हैं. ठीक है, अब मैंने आप लोगों को बताया कि बॉडी होती है और बॉडी का ये हैंड्स होते हैं, इनको हम लोग यहाँ पे प्रोसेस बोलते हैं. कि बोन है, बोन का मेजर पार्ट क्या होता है, बॉडी, और उसके जो प्रोजेक्शंस होते हैं उसको हम लोग क्या बोलते हैं, प्रोसेस बोलते हैं. उसके जो प्रोजेक्शंस होते हैं उसको हम लोग क्या बोलते हैं, प्रोसेस बोलते हैं. अब इसकी बॉडी में सबसे पहली बात, इसकी बॉडी किस तरीके से आपको दिखाई देती है, दैट इज इट इज ट्रायंगुलर इन शेप. It is triangular in shape and it is larger in size. It is larger in size. It is larger in size. Okay, it is larger in size. Now guys, try to see कि इस बॉडी में 3 पार्ट्स हैं जो आप लोगों को मेजरली पढ़ने हैं. सरफेस, बॉर्डर और एंगल्स. सरफेस, बॉर्डर एंड एंगल्स. नाउ गाइस रिमेंबर, इसमें 2 सरफेस होते हैं बच्चे. एक आगे की तरफ, अब सपोज ये मेरा स्कैपुला है, इस स्कैपुला के 2 सरफेस होंगे. जो एक आगे की तरफ आपको देखने को मिल रहा है दैट इज कॉल्ड एज द एंटीरियर सरफेस, और एक जो पीछे की तरफ देखने को मिल रहा है दैट इज कॉल्ड एज द पोस्टीरियर सरफेस. इट्स जस्ट लाइक अ पीस ऑफ पेपर, एक एंटीरियर और एक पोस्टीरियर. ठीक है, सो विल जस्ट मेंशन इट ओवर हियर कि वी हैव 2 सरफेसेस एंड रिमेंबर कि ये दोनों सरफेस कौन कौन से हैं. एक तो एंटीरियर सरफेस, और एक हो जाएगा पोस्टीरियर सरफेस. पोस्टीरियर सरफेस, anterior surface and posterior surface. Now guys, can anyone tell me कि ये वाला जो सरफेस अभी आप लोगों ने, अच्छा चलो ये आपने बता दिया. ओके ओके, ये वाला सरफेस कौन सा होगा? विच सरफेस इट विल बी? ये कौन सा सरफेस आप लोगों को देखने को मिल रहा है? I don't know, students are not participating right now or what has happened. I will not take classes if less number of students will participate. I really want maximum number of students to join the class. And नहीं बच्चे, अभी सिर्फ हम प्रांजल हम लोग पीछे से देख रहे हैं, तो ये ऑटोमेटिकली इट विल बी द पोस्टीरियर सरफेस. या सौम्या, हितेश वेरी गुड, करणवीर, Ayush very good, Yash very good, Anmol very good. It is the posterior surface. Okay, it is the posterior surface. It is the posterior surface. अच्छा, अब इसी के आगे एंटीरियर सरफेस होगा. अब एंटीरियर सरफेस जो है इसके जस्ट आगे वो किससे अटैच्ड है? रिब्स से अटैच्ड है. देख सकते हो ये रिब्स जा रही हैं बिल्कुल. एंटीरियर सरफेस से अटैच्ड क्या है? रिब्स है. ठीक है, एंटीरियर सरफेस से अटैच्ड आगे क्या है? रिब्स है. तो अल्टीमेटली व्हाट आई कैन से कि एंटीरियर सरफेस को मैं कोस्टल सरफेस भी बोल सकता हूँ. कोस्टल सरफेस भी बोल सकता हूँ क्योंकि ये वाला जो सरफेस है यहाँ से रिब्स अटैच्ड है, यहाँ से रिब्स अटैच्ड है. पोस्टीरियर सरफेस पर कोई रिब्स अटैच्ड नहीं है. पोस्टीरियर सरफेस पर कोई रिब्स अटैच्ड नहीं है. सो अल्टीमेटली एंटीरियर सरफेस जो है, ठीक है, वो रिब्स से अटैच हो रही है एंड दैट इज रनिंग ओके जस्ट फ्रॉम लाइक इन फ्रंट ऑफ द एंटीरियर सरफेस. दैट्स व्हाई एंटीरियर सरफेस इज आल्सो कॉल्ड एज द कोस्टल सरफेस गाइस. ओके, अपार्ट फ्रॉम दैट गाइस वी हैव 2 border. Okay, we have 3 borders. Now you can very well appreciate 3 borders कौन कौन से हैं सर? अभी हम लोगों ने बात की, एक तो मीडियल बॉर्डर, देन वी हैव द लेटरल बॉर्डर जो लेटरल साइड पे है, और एक बॉर्डर जो है ऊपर की तरफ होता है दैट इज कॉल्ड एज द सुपीरियर बॉर्डर. दैट इज कॉल्ड एज द सुपीरियर बॉर्डर. अब सपोज ये स्कैपुला है, तो यू कैन वेरी वेल अप्रिशिएट फ्रॉम द पिक्चर ओवर हियर कि यहाँ पर यू कैन जस्ट सी ओवर हियर कि यहाँ पर लेटरल बॉर्डर है. लेटरल बॉर्डर की आइडेंटिफिकेशन क्या है कि ये ग्लेनॉइड कैविटी यहाँ पे प्रेजेंट है. मीडियल बॉर्डर प्रेजेंट है और एक ये सुपीरियर बॉर्डर है. तो हमारे 3 बॉर्डर्स हो गए. ओके, यस, वी हैव द 3 बॉर्डर्स. यस, 3 बॉर्डर्स हो गए. अब 3 एंगल्स की अगर हम लोग बात करें तो इसमें 3 एंगल्स देखने को मिलते हैं. वी हैव 3 एंगल्स एंड यू गाइस शुड नो एक तो सुपीरियर एंगल बनता है, एक इंफीरियर एंगल होता है और एक लेटरल एंगल होता है। तीन एंगल्स होते हैं, सुपीरियर एंगल, थ्री एंगल्स, दैट इज द सुपीरियर एंगल, देन वी हैव द इंफीरियर एंगल नीचे की तरफ, and we have the lateral angle on the lateral border, lateral angle on the lateral border, lateral angle on the lateral border. So you can identify these three angles which I have marked: the superior angle, the inferior angle, and the lateral angle, guys. The lateral angle, guys. I hope till now the body part is somewhat clear to everyone. Yes, Akash, you are absolutely right. You have just give me a thumbs up that everyone has written as of now, and everyone is along with me, so that I can move further, and we can have a discussion over here right now. Yes, sir, clear hai, Dinesh, Kamal. Guys, I don't know why others are not participating. I will not organize sessions in future if I'll get a very less response. I'm very much particular about this. I want, if I'm doing a lot of hard work, I want everyone to participate. I just want everyone to participate, guys, and that is what is required as of now. Okay. Anyways, guys, students not participating, I'll just anyways leave, it's all done as of now. नहीं करना है तो I'll just wind this. Okay. आकाश, अभी हम लोग मसल अटैचमेंट्स पढ़ेंगे, डोंट वरी एट ऑल, विल जस्ट डू इट अगेन topic wise, guys. Okay, so now coming on to the different parts of the scapula, we have already studied. Now I just wanted to mention the three processes, guys. The three processes, you can see the spinous process over here. This particular structure, that is the spinous process, guys, which I just mentioned. So it is the spinous process. Then we have the acromion process, and we have the coracoid process. So we have the spinous process, acromion process, and the coracoid process. These are the three projections of the scapula that you can very well appreciate in the given diagram. Apart from that, guys, remember we have three notches that you have to we have three notches also. We have three processes, we have three notches as well, and these three notches are supra scapular notch, suprascapular notch, that I am marking with a different ink color right now. You can very well appreciate that this blue, this is the suprascapular notch. This is the suprascapular notch that I am marking over here. You can appreciate suprascapular notch, a shallow depression that you can appreciate just ending of the superior border, that is the suprascapular notch. Coming on to the next, that is the supraglenoid notch. You can see the notch over here, that is the supraglenoid notch, spinoglenoid notch. Okay. Okay. Yeah, we have the three notches, guys. Yes. You just write it spinoglenoid notch, and one more that we have to like notice over here, it is the circumflex scapular notch. Circumflex scapular notch. I'll just show you it in another few minutes. Okay, we have on different slides. We'll discuss it one by one. Okay, so yes, I just Apart from that, guys, remember that we have three tubercles also. We have three notches, three process, and three tubercles. Three tubercles. And remember, these three tubercles are supraglenoid, supraglenoid tubercle, infraglenoid tubercle, and we have the tubercle of spine, tubercle of spine. Okay, so that I will just try to show you on other slides as well. So you can very well appreciate over here, guys, that we have the supraglenoid tubercle. Okay, we have the infraglenoid tubercle, and you can appreciate the suprascapular notch. Okay, you can appreciate the superior angle also in this particular view. Okay, now guys, I will start with the surface of the scapula. So yes, just Duke of Doom, मतलब interesting names रखते हो. And yes, now I will start with each and everything like whatever we have discussed. Yes, so first I'll start with the surface of the scapula. Okay. So just give me a thumbs up, guys, that you all are ready, and we are just going to start with the surface of the scapula now. Yeah. So remember, देखो, अगर हम ये एंटीरियर सरफेस लेते हैं तो ये किससे अटैच्ड होती है? कोस्टल रिब से. That is attached to the coastal ribs, guys. Yeah, and that's why the anterior surface of the scapula, it is also called as the coastal surface of the scapula. Anterior surface, it is also called as the coastal surface of the scapula. It is also called as the coastal surface of the scapula, क्योंकि ये कोस्टल सरफेस से अटैच्ड होती है. रिमेंबर गाइस, इस एंटीरियर सरफेस में एक हॉलो डिप्रेशन प्रेजेंट होता है, दैट इज कॉल्ड एज फोसा, एंड दैट्स व्हाई द नेम, इट्स जस्ट अ सब स्कैपुलर फोसा. ओके, इट्स अ सब स्कैपुलर फोसा. ओके, remember that the anterior surface, it is slightly concave, it is slightly concave, and remember it is forming the subscapular fossa. It is forming the subscapular fossa. It is forming the subscapular fossa. Apart from that, guys, remember that we have another okay, now this subscapular fossa, it is more directed forwards. Okay, the subscapular fossa, it is directed forwards and medially. It is more towards the medial side. It is more towards the medial side. Now this is actually which view you are going to tell me. Okay, that is the interior view, that's already clear, I suppose. And okay, you can see the medial border over here. So remember, that is more forward and towards more medial. Okay, it's the fossa is lying towards a medial aspect. Okay, and remember, guys, that we have another surface. Okay, we have another surface that is called as the dorsal surface of the scapula. That is called as the dorsal surface of the scapula. That is called as the dorsal surface of the scapula. And remember, dorsal surface, or also called as the posterior surface. posterior surface of the scapula. Now guys, simply understand that, now suppose this is the dorsal surface of the scapula. This surface is basically divided into two parts by spinous process. Spinous process is a projection of this particular surface. ठीक है, एक लाइन की तरह है जो पीछे वाले सरफेस को दो पार्ट्स में बांटती है, एक इस पेन से ऊपर वाला हिस्सा और एक इस पेन से नीचे वाला हिस्सा. सो यू कैन सी द स्पाइनस प्रोसेस और द क्रेस्ट ऑफ द स्पाइन. एक हिस्सा इसके ऊपर और एक हिस्सा इसके नीचे. सो अल्टीमेटली व्हाट वी हैव, सो रिमेंबर इट इज बेसिकली डिवाइडेड बाय spinous process or crest of spine into two parts, supra spinous fossa and that too a depression guys. Okay, एक ऊपर वाला बिल्कुल छोटा सा that is the supraspinous fossa और एक उसके नीचे वाला that is called as the infraspinous fossa, that is called as the infraspinous fossa, that is called as the infraspinous fossa. So ultimately guys, remember कि supraspinous fossa, okay, supraspinous fossa, okay, it will give rise to a muscle that is called as supraspinatus. infra वाला infraspinatus. infraspinatus का surface area बहुत ज़्यादा है as compared to the supraspinous fossa, as compared to the supraspinous fossa guys. Okay, so that is about the posterior surface that is divided by the spinous process into two parts, that is divided by the spinous process into two parts. Now guys, coming on to the next, that is the borders of the scapula, that is the borders of the scapula. And you can very well appreciate guys कि borders, तीन borders आप लोगों को बताए थे. superior border that is just above superior border, मीडियल बॉर्डर और लेटरल बॉर्डर. लेटरल बॉर्डर की पहचान क्या है, यहाँ पर ग्लिनॉइड कैविटी देखने को मिलेगी, यहाँ पर ग्लिनॉइड कैविटी देखने को मिलेगी, ये ह्यूमरस के साथ आर्टिकुलेट करती है. ओके, या ये स्पाइनोग्लिनॉइड नोच होता है, या दे बोथ आर कनेक्टेड. आई हैव टोल्ड अबाउट द नोच आल्सो. ओके, नाउ गाइस कमिंग, अभी हम दोबारा नोच के बारे में डिस्कस करेंगे, डोंट वरी. अभी हम सारे पार्ट्स को दोबारा से देख रहे हैं, फिर उनकी मसल अटैचमेंट्स भी देखेंगे. So guys, remember we have the superior border over here. We have the superior border, and remember the superior border, it is the shortest and sharpest border. It is the shortest and the sharpest border. Apart from that guys, coming on to some other points of demarcation, how to actually localize the superior border. Remember that it lies opposite to the second rib. It lies opposite to the second rib. And one more thing, okay, that it forms a junction between the superior and the medial. Okay, no, okay. Can you appreciate a junction over here? Okay, that is actually a notch which is present. So remember, it presents a suprascapular notch. It presents a suprascapular notch, and remember, it is near the root of the coracoid process. देखो ये रेड वाला जो है ना, ये पूरा का पूरा क्या है, कोराकॉइड प्रोसेस है. ये क्या है, कोराकॉइड प्रोसेस. और कोराकॉइड प्रोसेस के जस्ट रूट पर क्या प्रेजेंट होता है, दैट इज द सुप्रास्कैपुलर नोच, दैट इज द सुप्रास्कैपुलर नोच, एंड दैट इज टू नियर द कोराकॉइड प्रोसेस, दैट इज टू नियर द कोराकॉइड प्रोसेस, दैट इज टू नियर द कोराकॉइड प्रोसेस गाइस. Apart from that, coming on to the medial border guys, medial border, you know, it is also called as the vertebral border of the scapula. It is also called as the vertebral border of the scapula, and remember, it is the longest border. It is the longest border. You can very well appreciate the length from the picture as well. It is the longest border and remember, it lies parallel to the vertebral spine. It lies parallel to the vertebral spine. It lies parallel to the vertebral spine. Now, what is the extension of the medial border? You can see the superior angle below to the superior angle above to the inferior angle below. So this border basically it extends from superior angle above to the inferior angle below, to the inferior angle below. Guys, I hope everyone is participating. Just give me a thumbs up that all are here. I cannot find everyone over here. I hope everyone is writing the notes. YouTube की भी खासियत होती कि we can all appreciate from the things like that you all actually कि मैं भी देख पाता तुम लोग क्या कर रहे हो वहां बैठ के, तो that would be again a fun to know actually see what you all are doing. मतलब I wanted to see at your end how all you are participating. Yeah, Vivek, Pranjal, Kamal, Anshay, Pavan. We have two Pavan over here. DJ is there. Dinesh, Shakir, Karanveer, very good guys. Lakshi, Garv, Ayush, Hitesh, New, very good guys. I don't know about the rest guys, but I really want that you all should clear the exam in one go, and that is what is required at this time now. Basics अगर नहीं पढ़ोगे ध्यान से, स्टार्टिंग से नहीं पढ़ोगे, you won't be able to clear the exam in one go. और अभी आप लोग क्लासेस ले रहे हो और एट द एंड आप लोगों को बहुत ज़्यादा फ्रूटफुल होगा. मार्क माई वर्ड्स, यू ऑल विल बी बेनिफिटिंग लाइक वेरी सून. अपार्ट फ्रॉम दैट गाइस, लेटरल बॉर्डर के बारे में भी जान लीजिए. प्रेक्षित, वेरी गुड. लेटरल बॉर्डर को हम लोग एक्सिलरी बॉर्डर भी कहते हैं क्योंकि वो एक्सिला के साथ आता है ना, ठीक है. तो that is why it is known as the axillary border as well. And yes, the points which is mentioned by Akshay, I suppose, Akash, yeah. Akash, yeah. Yes, you all will clear, and that should be the Josh guys, that should be the Josh I wanted from you people. Okay, so remember that a lateral or the axillary border, it is the thickest border. It is the thickest border, and remember it gives multiple attachments. Okay, it gives multiple attachments, and remember it extends from the lateral angle, and that is the glenoid cavity. That is the glenoid cavity to the inferior angle. You can very well appreciate कि glenoid cavity lateral angle से लेकर inferior angle तक lateral border is running, and this is the thickest border, and that is providing a lot of muscle attachments, guys, and that is providing a lot of muscle attachments, and that's why it is as such required right now. Okay, so I hope all the borders are clear to everyone. Yes, very good guys. Yes, okay. Sure, very good Akash, very good. Yeah, I'll just come to the tubercles as well. Okay, angles के बारे में थोड़ी सी जानकारी ले लेते हैं. So remember that we have three angles. एक तो superior angle हो गया, एक ultimately we have the lateral angle, और एक inferior angle हो गया. So remember that superior angle, it is basically a right angle. Okay, it is nearly I can just say the word nearly. It is a right angle. Yes. Dinesh, Kamal, Shakir, very good. Rafiq, Chaudhary, very good. Hitesh, Pranjal, very good, guys. I'm truly happy that you all are participating in spite of all the issues. Yes. चलिए, तो remember guys that superior angle, it is basically a right angle and it lies opposite to the second rib. It lies opposite to the second rib, and yeah, it forms the junction between the superior border and the medial border. ये junction बनाता है superior और medial border के बीच में. So yes, we'll just mention this point also. It forms the junction. It forms the junction between the superior and the medial borders. Between the superior and the medial borders. Between the superior and the medial borders. Coming on to the inferior angle, remember that inferior angle, it is basically an acute angle. It is basically an acute angle, and inferior angles basically lies opposite. Just to the seventh rib. Basically it is attached to the seventh rib, so just opposite to the seventh rib. Apart from that, basically it forms the junction of the lateral border and the medial border. ये lateral border हो गया, ये medial border हो गया, तो ये junction बनाता है between the lateral border and the medial border. So ultimately it is forming the junction between the lateral border and the medial border So it is an acute angle. It lies opposite to the seventh rib. It is actually a junction between the lateral borders and the medial border. So that is, yeah. Now remember that coming on to the lateral border, guys, the lateral border, remember that in lateral border, अभी हम लोग अटैचमेंट्स पढ़ेंगे, डोंट वरी, बट पहले हम लोग पार्ट्स के बारे में पढ़ लेते हैं प्रेक्षित, एंड देन आई विल टेल यू द अटैचमेंट्स इन अ वेरी इजी मैनर. ऑरिजिन इंसर्शन एक स्लाइड में याद हो जाएगा. सो जस्ट बिलीव मी, बी इन द क्लास, एंड आई एश्योर यू कि आप लोगों का टाइम बिल्कुल वेस्ट नहीं होगा. मेरे साथ क्लास कर रहे हो आप लोग, आई एम एश्योरिंग यू कि स्कैपुला विल बी अ पीस ऑफ केक फॉर यू गाइस, और क्वेश्चंस बाहर नहीं जाएंगे नोट्स में से अगर स्कैपुला के ऊपर कोई भी क्वेश्चन आता है तो. That's my guarantee of teaching. So coming on to the lateral border, okay. So lateral border पर आपको एक एंगल देखने को मिल रहा है, that is called as the lateral angle. That is called as the lateral angle. And remember, this lateral angle is basically enlarged to form the head and neck of scapula. So ultimately it is just enlarging to form the head and neck of scapula, okay. And you know that this lateral angle basically it lies between, or it lies between superior and lateral border. It lies between superior and lateral border. Yes. It lies between superior and lateral borders. मुझे एक चीज समझ नहीं आ रही, क्लास यहाँ चल रही है, लोग इंस्टाग्राम पे जो क्वेश्चन डाला था सुबह उस पर क्यों कमेंट कर रहे हैं? मतलब दे आर नॉट अटेंडिंग द क्लास, दे आर आंसरिंग द क्वेश्चंस ऑन इंस्टाग्राम. कहाँ से आते हैं ये लोग, मतलब पता नहीं. सो ठीक है, आंसर्स करो, बट अभी क्लास का टाइम है तो यू शुड पार्टिसिपेट इन द क्लास. दैट्स व्हाट माय पॉइंट इज, ओके. Yeah, so that was about the lateral angle, guys. So all the angles, all the points that I have mentioned on the screen, that should be clear to you. That should be clear to you guys. Yes. Yeah, lateral angle, yeah, bears the glenoid cavity, Akash. Very good. Okay. Yes. Actually, Akash, I wanted to mention a point. Basically, it gives the margins of this particular thing, basically give attachments to the labrum glenoidal. Basically, it is a fibrocartilaginous slip, okay, which is actually attached, okay. So, yeah, so that we will talk, yeah, that we'll talk a little later now. Now we have three fossas, guys. You can very well appreciate subscapular fossa. And remember that this fossa is basically the concave ventral aspect of the scapula. Ventral aspect of scapula. Ventral aspect of scapula. Apart from that, you have another fossa that is called as the supraspinous fossa. Supraspinous fossa, okay, and it is on the dorsal side, posterior की तरफ होता है. So it is the area of the dorsal surface, area of the dorsal surface lying above the spine. ये spine की just ऊपर की तरफ है, lying above the spine, lying above the spine. Coming on to the next, that is the infraspinous fossa. Okay, so it is the area of the dorsal surface, lying below the spine, lying below the spine. spine यानी कि spinous process हो गया, ठीक है. अब suppose ये posterior aspect में आपको दिखा रहा हूं. So this is a pen like structure, that is the spine. This spine is actually dividing this posterior surface को दो हाफ में डिवाइड करता है. एक ऊपर वाला that is spine के ऊपर supraspinous fossa, और पेन के नीचे वाला एरिया that is the infraspinous fossa. So ultimately that is just lying below the spine. And yes, हाँ, crest of spine, spinous process बोल सकते हैं. Yeah, very good, very good. Okay, and yeah, it's the lower surface of the spine. The scapula, you can very well appreciate, it's the lower surface over here. Yes, so that is about the three fossas of the scapula. That is about the three fossas of the scapula. All the fossa, all the angles, all the borders, all the surfaces are clear, I suppose. Site determination, anatomical position, type, and the general points. I hope all these points are clear to everyone now. I hope, just give me a thumbs up that all of you understood today whatever we have discussed. Yeah, whatever we have discussed, you have understood today. I will continue the class tomorrow and we'll discuss the processes of the scapula, okay, and all the muscle attachments tomorrow. If you promise to attend the class on a regular basis, I will take a class daily. If you will participate, if only 15-20 students will participate, I will not conduct the class in future, and that's too I will just check in the next 2 sessions. If you people will participate, I'll continue, otherwise I'll just I'll stop the classes, because it's of no use teaching 15 students out of so many. Like, I don't know why, what is the reason students don't want to study, or like it's okay. So just let me know your consultations, what you want, guys. Yes. Karanveer, it will take another 1 hour, and tomorrow I will continue part 2 where I will be discussing all the processes. I just don't want you guys to take so मतलब mug up नहीं हो जाए चीज़ें ना, तो इसलिए I just mentioned all the things in a very clear crystal manner on the screen. Everything in detail, guys, I have discussed. No one will like take this yeah. I will continue. I'll just see the another 2 days response, and then I'll see what I have to do, because just 15-20 students participating, and that too without like I don't know. Anyways, chal. So that is my mobile number, and the Telegram group you guys can join. And remember, it is Dr. Abhijit Kumar Medical Insights. Okay, Dr. Abhijit Kumar Medicine Insights. You can join my Telegram group. It's private. I mean, it's public now. Earlier it was. So yeah, just let me know. I'll like conduct the classes. I hope you all enjoyed the session today. Yeah, I'll just end the class today as such. Yes. Okay. Okay. Akash, I'm discussing all the points which are relevant from Grey's Anatomy as well. So I hope, yeah, whatever I will be discussing, I'm discussing in very detail. So yes, for everything, yeah, basics are the foundation for any particular exam. Basics clear नहीं है तो कुछ भी पढ़ लो, it's like of useless है वो. ठीक है, so that is my point of saying things. Basics आने चाहिए. So ठीक है यार, thank you so much for your patience. You're listening me. I'm truly happy, guys. I'm truly happy. And students not participating, I don't know what I have to say, but seriously, I'm like okay, okay, guys. So just ending the class now. Goodbye, guys. Thank you. Yeah. Goodbye, everyone. Goodbye. Yes, Pranjal, just okay, welcome.